Hello students, welcome to this video lecture on voices from the field. In this video lecture, we are going to discuss one case model, that is Arvind Eye Hospital. Everyone knows Arvind Eye Hospital in India. It is one of the most renowned examples of a successful social enterprise in the healthcare sector. Of course, we can say they are the pioneers in the field in India. It was founded in India. It has been founded in India, and it has transformed the way the eye care is delivered. Of course, we can say they revolutionized, right? Particularly to the poor, while maintaining at the same time the financial sustainability. So let's have a detailed overview of Arvind Eye Hospital as a social enterprise, and this is the background of the problem statement: preventable blindness in India. Of course, India has one of the world's highest rates of blindness. So 80% of this blindness is preventable and it can be curable. The major reasons for this blindness is cataract, refractive errors, glaucoma, and people are not able to afford and they are not able to have or access the eye care in rural areas. So this is the main problem statement. And this eye care foundation, Arvind Eye Care Foundation, was founded in the year 1976. It was founded by Dr. Govindappa Venkataswamy, and the location is in Madurai, headquartered in Madurai, Tamil Nadu, and of course now they have branches all over across India. The main mission is to eliminate needless blindness. So there's 80% of the blindness which can be cured. So their main mission is to eliminate that. Yes, so the mission and mission statement: to provide a high quality, compassionate eye care to everybody. And their vision is to create a world without needless blindness. Okay, so if we are blind, okay, we will not be able to contribute 100%. So if we have vision, we can contribute. So indirectly, it adds or helps the growth of the economy also. So their main emphasis is on efficiency, affordability, and equity. So efficiently, okay, doing the work, and affordable. Everyone should be able to afford that, the price, and equity. Everyone is treated equal. So this is they give stress to all these factors, emphasize all these factors, and this is a social enterprise model. How can we classify under social enterprise model? So it operates with a hybrid model that balances social impact with financial self-sufficiency. They need to generate money to run the foundation. So how they are doing it? Okay, so they are following a hybrid model. So inclusive service delivery. So Arvind provides high quality eye care to everyone, regardless of their ability to pay. So patients choose between, they have options: paid services, so comfortable amenities, shorter wait times. So paid, those who want to pay and they want to get the service can also avail that, and free or subsidized services. Same medical treatment will be provided, basic amenities will be there. So there are two types. One is paid, where there is, wait time is very less, and they will have some comfortable amenities. In free subsidized services, the same medical treatment will be provided, but they will be having basic amenities. Might be the waiting time, queue might be a big one. The same doctors perform surgeries for both paying and non-paying patients. So there is no discrimination, ensuring equal care and quality to everybody, regardless whether you are pay or free. Sustainable financial model, how they are sustaining their revenue model. Okay, 70% of the patients receive free or heavily subsidized care. So the remaining 30% are come under paying patients. So they generate enough revenue to cover the entire operational cost of the hospital. So this 30% people, they provide or they cover the fee offered by them, cover the entire operational cost of the hospital. So there is no need for them to depend on external funding for operations. So this model, this hybrid model, is highly self-sustaining. So it also generates surplus while providing free services. So minimal external donor dependency. They need not depend on donors, and efficient cost structures. They are also able to afford treatment at a subsidized cost. High volume, low cost. So Arvind performs millions of surgeries annually. Okay, there is a large queue. So more patients means fixed cost, more income. So buildings, equipment, staff training. Okay, that is spread across more people. So per patient cost drops. This is how they are maintaining that. Surgeons are highly productive, performing up to 2,000 surgeries per year each, compared to the global average of around 400. So each and every surgeon there, they perform up to 2,000 surgeries per year, whereas the global average is only around 400. Standardized and efficient processes. Govindappa Venkatasamy, one of his visits, okay, he was inspired by McDonald's. Repeatable, optimized steps for surgery and eye care. McDonald's standardization, okay, assembly line technology. See, so he thought, okay, when assembly line technology can be used to produce burgers which are being sold in each and every street corner in the US, why can't we apply the same for this healthcare also? So this is the thought. This was the thought, okay, that he got while one of his visits to US. So example, cataract surgeries are done in a conveyor belt style. So this is the outcome. Each surgeon focuses only on the surgical part while trained staff prepare and assist. So what happens? The doctors will do only the surgery. They will not, okay, do pre-operative preparations or post-operative preparations. The trained staff, they will do everything. Only the doctor has to do the surgery. So it reduces downtime and increases daily surgeries per doctor. They concentrate only on the surgery. Division of labor. Surgeons, as I told you, focus only on surgery, no administrative work or no preparative work. So trained paramedics do all the non-surgical tasks, right from preparing the patient to measurements and post-operative care also. So that increases doctor productivity and reduces labor costs. And infrastructure and innovations. So telemedicine and rural outreach programs bring eye care to remote areas. They concentrate mainly on rural areas. Vision centers act as primary care units in villages. They have established vision centers in many rural areas. Arvind has its own manufacturing unit, Oro Lab, which produces low-cost intraocular lenses and surgical instruments, significantly reducing surgical costs. This is one of the reasons for low cost. They have their own lab to produce a unit to produce the lenses and other instruments. So no dependency on expensive imports, right? So lower material costs. So that reduces the cost of the surgery. Efficient use of surgical tools, space and medical staff. So everything is efficiently planned and organized, structured. Centralized procurement and bulk buying reduce supply costs. So these are the ways they are purchasing things and producing things that reduces the costs of the surgery. Workforce model. It trains rural women as paramedical staff, 70% of the workforce. They recruit people from the rural areas, they train them as paramedical staff. So 70% of the workforce are from rural women. So this one builds local employment and also empowers women. So paramedics manage diagnostics, patient preparations and logistics. So it frees up doctors for higher value tasks like surgery. So it reduces the doctor's load. Okay, it frees the doctors from doing administrative work and preparatory work. rural outreach and eye camps. Every year, Arvind Eye Care conducts around 2,500 plus rural eye camps, and it also screens over 5 lakh people in remote areas. It provides offers free transport, food and accommodation for patients also, and it builds community trust and extends access beyond cities. Telemedicine and vision centers. So they have 100 plus vision centers across India. It is connected, or each vision center is connected to main hospital via satellite and internet. Real-time remote consultation with specialists, and it also offers vision centers handle basic treatments and spectacles. Vision centers, they do basic treatments and spectacles. They also provide spectacles. Training and knowledge sharing. LICO, Lions Arvind Institute of Community Ophthalmology. It trains 300 plus hospitals worldwide in Arvind's model. It shares best practices in efficiency, management, and outreach. And it also promotes global eye care capacity building. Impact metrics. It has treated 70 plus million outpatients since 1976. It has performed over 7 million surgeries, and Tamil Nadu has one of India's lowest blindness rates. So, thanks to Arvind Eye Care. And Arvind model scaled to Bangladesh, Nigeria, Ethiopia, and inspired global replication of its model in other countries and contexts. Many countries, they are inspired by this model, and they have started similar type of eye care in their own countries. So it has been recognized by organizations like World Health Organization and Harvard Business School. Workforce and culture. Strong focus on efficiency, training and mission alignment. They are trained, staff members are trained, uses a paramedical workforce extensively with a large number of trained women from rural areas. So staff are often motivated by purpose rather than just profit. Recognition and awards. Recognized by World Health Organization and Harvard Business School case study. It has received Gates Awards for Global Health, Conrad and Hilton Humanitarian Prize. It has been featured in global publications like Time, Forbes, and Stanford Social Innovation Review. Innovation and service delivery. It has been inspired by McDonald's, process-driven, replicable, and scalable. It has got localized manufacturing unit, Oro Lab, which drives cost reduction. And it also encourages paperless operations and AI-driven patient diagnostics in use. And it has decentralized approach via vision centers and mobile units. Challenges faced. Maintaining scalability without compromising quality is a challenging task. Addressing rural infrastructure and digital gaps. Okay, so internet facility will not be there. Okay, accessibility will be a difficult thing. So all these things are challenges. Attracting and retaining top medical talent. Yeah, of course, that is retaining the talented people is another challenging stuff, because they will be attracted or they'll be in demand. So retaining them is another challenge. Adapting to emerging healthcare technologies. So that is another challenge they are facing. So what are the key takeaways? Arvind shows healthcare can be equitable, that is, everybody can afford, and profitable, combine spiritual philosophy, business acumen, and compassion. It is a strong case for frugal innovation in public health, a replicable global model for low cost, high impact service. Thank you.